Okay, welcome to a video about basic thyroid anatomy and physiology. This is Dr. Chad Miller. I'm with CNS Rehab, and we're going to talk a little bit about the thyroid. Not a lot to say anatomically. It's sitting right over the top of your windpipe, kind of a butterfly shape, soft, smooth, shouldn't feel any swelling, any nodules, anything off like that. We'll take a look at that, but that we need to take a little bit deeper look, and a lot of times we'll send out for an ultrasound if that's needed. But many times we're just dealing with altered physiology. And altered physiology, again, we'll do a little bit deeper look than traditionally is done. So now we'll take a look at what's going on throughout the whole body. It's important to look at all the straws in the camel's back, if you will. We have to look at the brain, we have to look at obviously the thyroid, we have to look at the adrenal glands, we have to look at the gut, we have to look at the liver, and we'll kind of go through that, and hopefully this makes sense. If not, just holler at me and I'll see if I can explain it a little bit better or differently. But with the brain, we're dealing with a couple of areas. Hippocampus we'll come back to, but hippocampus basically is logging. Its main job and most of its research in there is logging short-term to long-term memory. It also has some downstream influence actually on corticotropin releasing hormone, but we'll get to that a little later. Hypothalamus, that's the master control system. That's kind of like the coach of the football team. He talks to the pituitary, which is the quarterback. So the hypothalamus, in this case, is going to send out thyroid-releasing hormone, telling the pituitary, hey, you need to stimulate that thyroid. We need to get that ball rolling. So pituitary sends out thyroid-stimulating hormone, TSH. This is a common marker that's tested by your medical doctor or other healthcare provider, and that looks at how basically the pituitary is working and how the pituitary is responding to what's going on downstream. Now, this is a stimulating hormone, so it's a hormone that's going to tell the thyroid, hey, you need to release a little more of what's called T4. T4 is an inactive hormone. It's called thyroxine, and it's 4 because it has 4 iodine molecules. Typical alternative practitioner would load people up with a whole bunch of iodine. Many times that's not the case, or is not appropriate, if you will, if you're not looking at the entire picture. So we don't want to look at thyroid as it's operating in a bubble or a vacuum, like many practitioners will. We want to look at it in its entirety and how is it working in the whole grand scheme of things. So T4 then is an inactive hormone released by the thyroid, but it's monitored by pituitary and the hypothalamus, and then that determines, again, if T4 is a little bit low, we need to stimulate a little more. So in hypothyroid cases, meaning low thyroid cases, you're going to see a high TSH number. So a high TSH number is indicative, not diagnostic, but indicative of a low thyroid situation. Many times, though, this little closed loop does not tell you how things are functioning further downstream. So even if your medical doctor does a big stretch and actually looks at T4 as well, you're still only seeing part of the picture. What has to be done then is T4 being inactive, it has to be activated. Well, where does it do that? It does that by conversion. Your body converts it to T3. 80% of that occurs in the gut and the liver. It occurs everywhere else, but 80% of that is in the gut and the liver. This is where most of your metabolism is occurring anyway. So if there's issues with liver, if there's issues with gut, you can see that there's a probability that you're going to have altered conversion. But you don't know that until you look. Again, you need to look. Issues with acute illness or even chronic illness, you'll see issues with reverse T3. This is, you're basically on purpose inactivating thyroid hormone to slow down the metabolism and in order to fight your battle, whatever battle you're fighting, some kind of infection or whatever's going on, you'll slow down the metabolism on purpose. We also want to look at resin T3 uptake, or T3 uptake. Basically it says how is the cell pulling in the T3 and producing that metabolism? If the cell is just saying, hey, cells are sick of it, I don't want to hear any more about T3, again, you can see issues with that, reducing the metabolism, slowing things down. So there's kind of a really basic look at what's going on with the thyroid. So the thyroid then is affected by all other aspects of the endocrine system or the hormonal system. You'll also see issues with estrogen elevations. So your body will, in certain cases with women or even men, if you're aromatizing, estrogen elevations will alter your ability to carry the T4 downstream to where it needs to go. And I kind of use the taxi cab analogy there. Basically, if you have issues with the carrier or the taxi cab downstream, you're not going to get where you need to go. Either there's too many taxi cabs and the taxi cabs don't want to let you out, kind of a supply and demand issue, or if there's not enough taxi cabs, they're too busy working with the estrogens, you're not going to have enough taxi cabs to take that T4 downstream to where the T3 needs to be converted. And again, you'll see that slower metabolism. But everything looks all pretty, all up in here. TSH numbers look good, T4 numbers look good. All right, just deal with it. If you have any other symptoms, you know, that should be all right. I disagree. So in addition to the estrogen elevations, you're also looking at the adrenals. So pituitary, the quarterback again here, is sending adrenocorticotropic hormone, and that's firing up the adrenals. Now the adrenals sit right up on top of the kidney, and the adrenals' main job is to basically run the metabolism when your foot's kind of down on the accelerator. Thyroid's running the metabolism when your foot's kind of off the accelerator and the engine's just idling. Adrenals are running when you gotta go. So the adrenals are good, and we need to have those stress hormones kick out, but not all the time. And any more these days, we're seeing people, adrenals are kicking out all the time. They're kicking out cortisol. Now cortisol is a stress hormone, and cortisol, lots of research on the detrimental effects of high cortisol over an extended period of time on other tissues and other activities of the body. It will break down the hippocampus, again affecting short-term to long-term memory. It affects TSH. It affects conversion. So again, affecting all kinds of metabolism, brain function, not a good situation. So you can see high cortisol kicking out in all kinds of situations. So I look at stress. We're looking at physical stressors, chemical or dietary stressors such as smoking, alcohol, crappy food, all that kind of stuff, and emotional stressors. Cortisol can be released even in an emotional stressors type of situation. So we're dealing with cortisol on several aspects. My job is to get the physical and the chemical aspects under control, and that's the way I kind of look at it. So what does all this affect? So this is still affecting other areas of the body. What's going on? All aspects of thyroid function. So they look at, it's dealing with bone metabolism, it's affecting and being affected by gastrointestinal function, growth hormones, body composition. Obviously, if you're low thyroid state, you tend to keep on that weight. High thyroid state, you're going to be burning it off, bouncing off the walls. Insulin and glucose metabolism is affected by thyroid, but so is cortisol. So insulin and glucose metabolism is affected by cortisol, and cortisol affects insulin and glucose metabolism. So they're all talking back and forth to each other. You have to look at the big picture. I can't say it enough. So estrogen metabolism, we talked about that. Cortisol, thermal regulation. A lot of docs will take a look at the morning temperature, axillary or armpit temperature, see what's going on there. And then other hormones such as progesterone and the sex hormones. We talked about estrogen just a little bit. And then the blood, what's going on with the blood, all affected by the thyroid function. So hopefully this gives you a little bit of idea of how, again, TSH is just completely insufficient in looking at what's going on with the thyroid, but also what's going on with the rest of the body, how you need to look at all of the straws in the camel's back and then address them also. And so if you have any further questions, feel free to email me. Our email is info info@cnsrehab.com. It's on the website here. And then also, you can give us a call, 402-420-2677. Again, I'm Dr. Chad Miller, and I hope this was informative to you and helps you out. Thanks.